everybody. Troy Nafsker, owner of the Advanced Spine Joint Wellness Center in Medina, Ohio. If you follow us on any of the social media or Facebook, you may have noticed that recently we placed some articles about sciatica and disc-related issues that cause pain running down the leg. By popular request, many folks, patients and even folks that aren't patients, had requested that we start maybe a video log to start educating folks on some of the issues that we face in America. Sciatica is one of the most common problems we see in our office, and it affects about 80% of Americans at some point in their life. And it's a very debilitating problem. So what we're going to do is briefly talk about what is sciatica, what can potentially cause it, and what are some of the treatment options for it. So sciatica itself can come from many different issues. The spine is made up of 24 freely movable joints, and if any one of these joints becomes damaged or injured for any reason, we can put pressure on a nerve, thus causing symptoms of sciatica. Now, some of the potential causes of damage or in the spine that can put pressure on the nerve could be something as simple as what's called the vertebral subluxation complex. And that's where a portion of the spine actually shifts out of place and is misaligned, putting pressure on the nerve, stretching the nerve, or just creating inflammation in the nerve itself and then causing symptoms of sciatica. We can also have issues like disc herniations, where the center of the disc, which is like apple jelly, squirts out and actually puts pressure on the nerve. Another potential problem that we see quite often in the office is spinal stenosis, where the tunnels where the nerves come from actually narrow, and that puts pressure on the nerve and then symptoms of sciatica. So those are all potential sources of the problem, and it requires a careful examination to find out exactly where the problem is at. Now, symptoms of sciatica. Symptoms can range anywhere from lower back pain that radiates across the back, down into the glutes or buttock, down into the hamstring, or with some patients and most, down the leg, into the foot, calf, or into the toes. And sometimes it's associated with numbness, tingling, and in some of the worst cases, even weakness in the leg. So those are some of the common symptoms that we see. Treatment options. There are basically 4 treatment options for this type of problem. The first one that everybody can potentially do is simply just ignore it. And if you've had sciatica or issues like this, you may find that simply ignoring it only allows the issue to get potentially worse with time. The second treatment option are medications. And a lot of folks fall into this potential pitfall with pain medications, narcotics, neuropathic or nerve pain medications, and they're highly addictive and, quite frankly, don't address the problem. They only tend to try to treat symptoms. They're not treating the problem, so we're not getting to the source of the issue. The third thing folks can do is potentially pursue surgery. And surgery is really only about anywhere from 40 to 60% successful, depending on the type of problem and where it's at. So we have just about a 50-50 shot with surgery of being better, and God forbid with some folks, worse and or the same following surgical procedures. Fourth, what do we need to do, or what can we do for sciatica? The most important thing we can do is learn how to non-operatively get pressure off the nerve. There are many different ways we can do that here at the Advanced Spine Joint Wellness Center. That could be anywhere from a chiropractic adjustment to what's called spinal decompression, and using other services in conjunction with this to allow us to get pressure off the nerve is what's going to alleviate the symptom and then retrain your spine to function properly for long-term maintenance of symptom relief. If you're suffering from this problem, don't feel like you're getting answers for the issue and continue to struggle. Feel free to give us a call for a complimentary consultation at 330-721-6504. Keep your eyes open for videos to come. Next week we'll be talking about migraines and migraine headaches and some of the breakthrough treatments we have here to provide permanent resolution for your symptoms. Thanks for your time. We'll look forward to seeing you next week.